Okay, hello, and this is a continuation of the previous video on anatomy. The video was titled as Inkling, and the basic thing is what anatomy is. So, the anatomy um, uh, is includes those structures that can be seen grossly without the aid of magnification and microscopically with the aid of magnification. Typically, when used by itself, the term anatomy tends to mean gross or macroscopic anatomy. So, anatomy as such can be studied as through regional approach and systemic approach. So while talking about regional approach, uh, if, like for example, if thorax is to be studied, all structures are examined. This includes the vasculature, the nerves, bones, and muscles, and all other structures and organs located in the region of the body defined as the thorax. And after this, studying this region, the other regions of the abdomen are studied. So, while talking about the systemic approach, uh, of the body is studied uh, and followed throughout the entire body. For example, a study of vascular system. So, while talking about the vascular system, we talk about the heart, all of the blood vessels in the body. When this is completed, the nervous system is there, and you have the renal system, respiratory, lymphatic, reproductive. So, this is the systemic approach of studying anatomy. And so, there are some terms which are to be known prior to studying anatomy. So, those are anatomical positions, and so this is an example of how uh, anatomical positions are. So the face looking forward, the inferior margin of the orbit level uh, with the top of the external auditory meatus, and okay, so add the hands by the side and palms facing forward, and you have the feet together. So while talking about the positions, you have the superior coronal plane and sagittal plane, and you have the anterior side and also the posterior side. So transverse, horizontal, and axial plane. So this plane is called as transverse, horizontal, or axial plane. So you have the medial towards the body, and away from the body is called lateral. And you have also the inferior position. Okay, you have the inferior position over here, and yeah. So okay, these are the anatomical positions. So anatomical planes. So you have the coronal plane. So we have I have just shown earlier how uh, uh, okay. So you have the coronal plane, sagittal plane, and transverse, horizontal, or axial plane. And okay, so these are the three major anatomical planes, and yeah, anterior, posterior, and medial, lateral, superior, and inferior. Three major pairs of terms are used to describe the location and structures relative to the body as a whole or to the other structure. And so anterior or ventral and posterior. So medial lateral is there, and inferior and superior inferior. And we have also the proximal and distal thing, distal way of defining uh, body locations. So for example, the hand is distal to the elbow and the glenohumeral joint is proximal to the elbow joint. So that's the way of talking, like proximal and distal. Cranial uh, and caudal. So cranial would be like towards the head and the caudal towards the tail. So rostral is used particularly in the head to describe the position of a structure with reference to the nose. So for example, the forebrain is rostral to the hindbrain. So superficial and deep. So superficial and deep, those structures that are on the surface of the body are called superficial, and those structures which is found deep inside the body are called deep. So for example, heart is deep, whereas the uh, ribs and sternum and epibrium are like superficial. So that's a way of uh, explaining those anatomical positions. And imaging techniques that we use in anatomy is, so you have radiography. So in 1985 William Röntgen used the X-ray from a cathode ray tube to expose a photographic plate and produce the first radiographic exposure of his wife's hand. And plain radiography is there. Okay, so this you have an example of how this X-rays are produced. And contrasting agents is there. Fluoroscopy unit is used. And okay, so contrasting agents are used to get a detailed view of internal organs. So the best contrasting agent is barium sulfate suspension. And you have the iodine, another contrasting agent. And okay, so there's something called the intravenous urography. So uh, you inject this contrasting agents, and mainly in the ureter and bladder kidneys, and we call that intravenous urography. So subtraction angiography is there. So angiography, so something related to the blood vessels supplying the heart. And okay, this is a diagram of uh, angiogram. So you can just visualize how this blood vessels are clearly shown here. So that would be like this would be like mainly from branching from the aorta. And ultrasound is there. So ultrasound is so okay, so there's an example of ultrasound. So ultrasound examination of the abdomen. So this is a good picture. And a Doppler sound. Okay, that's the how this ultrasound works. And computer tomography is another way of uh, uh, another way in which we can get imaging out of it. So this is an instrument shown here, computer tomography scanner. So another one is MRI imaging. So MRI imaging, so computer tomography scan of the abdomen at vertebral level L2. And so MRI scan, so magnetic resonance imaging. And so T1 weighted, T2 weighted images are there. So this is a cross section of uh, brain skull, where you can see the brain and all the lower aspect. And Okay, so based on the T2 weighted imaging and T1 weighted imaging is there. So magnetic resonance imaging of the brain. So another one is nuclear medicine imaging. So you use some radioactive substance. So you have some technetium 99M with methylene diphosphonate. So that's a good contrasting agent. So radioactive substances are used. So in positron image emission tomography, so various similarly, like radioactive substance are used. So positron emission tomography is an imaging modality for detecting positron emitting radionuclides. A positron is an anti-electron which is positively charged particle of the antimatter. So the radio contrasting agents are fluorodeoxy glucose and fluorine uh, 18. So image interpretation. Uh, okay, so I will be dealing with image interpretation later on. So this is regarding images. So these are the instruments used for medical imaging. Okay, so I will be dealing with the rest of the things later on. So thanks for listening.